Good morning.
Good morning.
All right, guys, let's get started. Finishing up the shoulder muscles today. Liz, I'm going to ask you, were you able to end up downloading the muscle list
No,
at all?
no.
Does anyone else having problems with their flashcard assignment seeing the muscles? Okay. All right. I will email it out to everyone to make sure you do have it. Yeah, that's what I thought too, Mercedes. I thought you just had to download it because I had another student who had an issue just viewing it on the computer, but once they downloaded it, it was fine. But that's okay. Guess it did not work for everyone, but I will still send it out to make sure everyone has it. Again, these are due on the our next exam. So the first group of muscles are due on the next exam, which is all upper extremity muscles. How's everyone doing in lab?
Good.
Good. Okay. All right. No one's really having any issues. Having a hard time with the quizzes, getting things done. All right. No, most of us are good. That's all I can take since that's all I'm getting.
Are there any quizzes due soon?
Say that again, John.
Are there any quizzes in this class that are due soon?
So we have a quiz on Thursday. I'm opening on Thursday in here. Last class, I mentioned it to you guys that I was going to open up a quiz the following Thursday, and it's going to be on the shoulder. And if we get to the elbow, then it'll be on the elbow, but I don't think we're going to get to the elbow. So it's probably just going to be all shoulder. All right, let's get started, guys. We will continue on. Give me 1 sec. I will pull up the PowerPoint. Who remembers where we ended up at? I think we only got through that one muscle, right?
The deltoid anterior is the last one we were at.
Okay, perfect. Okay. No. Are you guys able to see the presentation? Or is it just in PowerPoint?
It's in PowerPoint.
What is going on? Man, I cannot wait to get back in person. This is crazy.
You and me both.
Did you guys hear the good news though that some classes like labs for next semester will be in person?
Yeah. That could be also like beneficial and like hard for people at the same time. Because what do people live for?
I think they're allowing it so you can live on campus.
Really?
Wait, we're allowed to live on campus?
I think so. Don't quote me. Don't quote me. But I'm pretty sure they're gonna work that out, especially majors that have students who are in clinical rotations and clinical internships.
So it's like an optional if you wanted to live on campus and do the labs.
Actually, I asked Dr. Rose that in our department meeting. I was like, what if people still have to like continue working or whatnot, have to live at home? I don't know if it's exactly optional, but I mean, if you were a commuter anyway, then it wouldn't make a difference. But
Yeah.
wait, if it's optional to live on campus, I'm sure it's totally optional. But if they are allowing labs to be back in person, I do not think that is an option. I think you have to go back if they're allowing labs to be in person. Like they're not doing the hybrid virtual and online thing.
I know for athletic trainers, he emailed us and said if you needed housing so that you could live there for the labs and clinicals.
Okay, yeah, there you go. There you go. That's good. That's good, guys. Take advantage of that if you can. Labs are meant to be online. I mean, in person. Sorry. Labs are meant to be in person. And that is how you are going to learn the most and engage yourselves the most, for sure. Oh, Andrea, were you doing track?
Yeah.
Yeah, I know things are getting like dicey again, like the numbers, COVID numbers. I'll be honest with you guys, I don't follow the news or anything like that. I really have no idea what's going on. I'm concentrating on making sure I can do all this and stay afloat, and working. So I don't really know what's going on with COVID and the numbers, but I do know things are getting a little bit dicey again. And with flu season coming around, I know things are going to get even more crazy. So it definitely is going to be a risk. And I wouldn't be surprised if all of this ends up changing back to being completely online. Yeah. Wow. Mercedes, if anyone saw that, she has a 1-bedroom to sublease. So subletting is great, very helpful.
I have a quick question.
Go ahead, Lexi.
Is anyone here in 285?
Yeah.
And do any of you know we have an exam tomorrow that's at a set time that we were never told about?
We do?
Yup, exactly.
Yeah, she
All
told
right.
us.
I just
On
wanted to
what?
make sure everybody's been saying no.
She told us.
Yeah, we were told. Our midterm, right?
But when were we told?
Last class. On Wednesday.
Told
yeah,
us
she
last
said
class.
it.
Yeah, she told us last class, but does anybody know if we're zooming in or are we just taking it?
No idea.
We have to be, I think we have to be on Zoom. I think she wants our cameras on.
Okay, that's what I thought. Thank you.
Is it on the syllabus?
Yeah.
Ah.
Half of us didn't, like, I just asked like 4 people and nobody even knew about it.
If it's on the syllabus, then that's on you, kid. I hate to say it. You should be responsible for looking at your syllabus all the time to constantly refer back to see where you are in the schedule. Granted, Jared said there's a study guide too, so but yeah, sorry. Anyway, let's let's finally get into the rest of our muscles. If you guys have any other questions about what's going on for the rest of the semester, I mean, for the next semester as well, feel free to ask, but let's get this going because we need to finish the shoulder today. I don't want to continue falling behind. But thankfully with the elbow, the wrist, and the hand, those are all covered fairly quickly. I'd rather spend a good chunk of time on the shoulder anyway, since it is a little bit more complex. Okay, continuing on with our shoulder joint muscles. So let's refresh. Who can tell me what is the difference between muscles that act on the shoulder joint versus muscles that act at the pectoral girdle? Anyone? How about muscles that solely act at the shoulder joint? What bone are these muscles moving? What's the common denominator between every single one of these muscles? They all insert where?
The clavicle?
No, where do they insert? So, okay, Tyler, good. Tyler said one moves the scapula while the other moves the humerus. Liz, good. Everything at the shoulder joint. So all these muscles up here that say shoulder joint muscles, they all move the humerus. And that's because they all insert on the humerus. Very straightforward concept. Whatever bone that muscle inserts on is the bone that muscle is going to move. So if all of these muscles are inserting somewhere on the humerus, that's the bone that's going to move. And they're going to create one of those actions that occur with the humerus. So flexion, extension, abduction, adduction, internal, external rotation, horizontal, AD, abduction, AB, and then regular abduction. And good, Tyler, like what Tyler said, everything with the pectoral girdle, all of those muscles move the scapula because they all insert somewhere on the scapula. Does that make sense to everyone? Before we continue, that's, again, pretty straightforward concept, but it's very important for you guys to remember that. Okay. All right. Now moving on with our pectoralis major muscle. So the pectoralis major is a shoulder joint muscle. We already talked about pec minor. What bone does pec minor move? And who remembers what are some of the actions for pec minor? Man, you guys are killing me. Pec minor moves the scapula. So pec minor is responsible for movements like protraction, does a little bit of depression, maybe a little bit of downward rotation. Here, the pectoralis major muscle inserts on the humerus. Okay, so the origin for our pec major, you could see here, it's a really large origin. It starts out, this muscle starts out super, super wide and then comes in very narrow. So the origin for our pec major muscle is going to be the medial clavicle and along the sternum, and then also costal cartilage of the ribs. So medial clavicle along the sternum and the costal cartilage of these ribs. So that's a really wide origin. And again, it all comes down and inserts on the medial, it's called the lip of the intertubercular groove or the bicipital groove. So the lip of the bicipital groove. Who remembers from AMP, the bicipital groove? What sits in the bicipital groove? How about our No, Mallory, you might be thinking the ulnar groove, and I like where your head's at. The bicipital groove, our biceps tendon sits inside of that. So that's why it's actually very common for anyone who has a pec major strain to have pain with their biceps tendon as well, because they sit and are located in the same area. So our pec major muscle is responsible for adduction and internal rotation. So adduction and internal rotation. So I want everyone to think about this very quickly. If we are laying supine, aka on our backs, and say we flex our shoulder about 90 degrees, if we fire the pec major muscle when we are in this position, it's also going to pull our arm. It's going to adduct our arm. But since we are laying down, that is called horizontal adduction. So you can add horizontal adduction to that as well. So the pec major, very large muscle. It creates a lot of force. So we talked about a few chapters ago how the shape of our muscle will determine if it is better at creating force or is it better for creating range of motion. Anyone remember what we said about these triangular, aka deltoid shaped muscles? Are they better for creating force or more range of motion? Force. Okay, good. Force. Excellent. Notice the fibers aren't all that long. They're shorter fibers, therefore they're able to create more force in this area, as opposed to, I'm going to jump to real quick, this muscle, the fibers are long and go straight down. So this muscle is more for range of motion because the fibers are longer, whereas this nice wide and shorter fibered muscle is better for creating force. Very good, guys.
Is that?
Oh, go ahead, Deshaun.
Is that why, like, if you like bench press, right? That's why, like, a lot of people, like, if they keep constantly bench pressing, they can bench like a lot of weight.
If they say that
like,
one time?
Like, say somebody like they bench press like 135, they constantly keep doing that repetition every week. That's why they can build their way up to like bench pressing like 300, 400 because more force, because more power there.
I definitely think that it has a lot to do with it. Your body, your own genetics, what type of muscle fiber you have. So remember we talked about type A fibers, type B, your nutrition. There's a lot of different components. I think that's going to have to do with it. Remember we also talked about people with really long arms as opposed to people with really short arms. Well, longer arms will have a harder time benching. So they'll never be able to build up as much force as opposed to someone with shorter arms. But I think that definitely will contribute towards it for sure. What this is saying by the fact that it's able to produce more force. Let's look at I don't know if anyone boxes here. I don't know if anyone is really into punching things or whatnot. Hopefully none of you have ever fought before. If you have fought, but there is.
I did boxing.
You do boxing, Naz?
Yeah, I did for about 6 years.
Wow. That's really cool. Their technique is everything. When you go to punch someone, are you going to come, well, if you watch my arm, you don't come all the way out like that to try and hit someone, right?
You can also pull something by doing it that much as well, because the amount of force that it takes to pull from like your arm being that wide out extended, and like if you the force of like pulling it too hard and too fast might like contract as well. So like that's why they always tell you like make your punches sharper and everything.
Yeah.
And obviously because it's too wide of a punch, but
okay, you said it, nailed it. Make your punches sharper. So it's that quick trigger, like cocked back motion to here. That is all activation of that pec major muscle. Our pec major, we put it on a stretch by going into horizontal abduction. And then when that pec major fires, it's coming forward into horizontal adduction. So that's how it's able to produce more force and less range of motion. Good. Great job, guys. And I will add in here the nerve. So the nerve for our pec major muscle, again, pretty simple because it has kind of the name in the nerve. The lateral and medial pectoral nerve innervates the pec major muscle. So that is the peripheral nerve for pec major. All right, moving on to our coracobrachialis muscle. Okay, coracobrachialis, very, very simple. It's pretty straightforward muscle in the shoulder itself. The origin, so this is one of the muscles that has the name of the origin and the insertion right there in it. So the coraco is the coracoid process. Remember, the coracoid process is that bony prominence directly, it's located on the anterior scapula. What muscle did we talk about already are inserts on the coracoid process?
Is it the pec minor?
It was the pec minor. Very good, Courtney. Pec minor. So the coracobrachialis, as you can see, the fibers, they almost run directly up and down, but they're on a little bit of an angle. So that actually says a lot as to when the insertion pulls towards the origin. So if we try and bring the medial side of this humerus up to the coracoid process, it's not going to bring it straight up. It's going to bring it up kind of on an angle. So the insertion pulls towards the origin and it follows that muscle fiber path here. And again, this is on an angle. So that's why this does not do straight flexion. It actually does a little bit of flexion along with adduction. Does that make sense to everyone? Okay, very good. So again, coracobrachialis, it's a shorter muscle. It does not contribute towards a lot of movement at all, let alone creating a lot of force, but it really doesn't even create a lot of movement, but it still will do that little bit of flexion and adduction. And the nerve is the musculocutaneous nerve. You're going to see there's actually going to be a few muscles in that area, all with that same nerve, which makes sense. There's a lot of peripheral nerves that innervate muscles by the region. So the musculocutaneous nerve is going to be a common one we see. Okay, our biceps brachii. Now we're going to cover the biceps again in the elbow, but we need to talk about the biceps in the shoulder because it is a biarticulate muscle. Who remembers what does biarticulate mean? Biarticulate. Okay, two articulations. So Mercedes, the biceps has two different origins, but what Liz said, it crosses over two different joints. Therefore, a principle we talked about a while ago, whatever joint that muscle crosses over is the joint, is the joint that's going to have motion at it. So the biceps crosses over our shoulder, and it also crosses over the elbow. So the origins start all the way up at the scapula, and then the origin comes down to insert on the radius. So biarticulate means it crosses over two joints, therefore it creates motion at two joints as well. So the biceps, that the muscle name is termed for bi meaning two, ceps meaning head. So two heads. As if you look, there's kind of two different muscle bellies there. When you guys look at your arms, you don't necessarily see two muscle bellies. It kind of looks all in one. And that's because this is all underneath one sheet of fascia. But there are two muscle belly heads, and it all comes together to create the one tendon that inserts down at the radius. Since our biceps muscle it's long, it starts all the way up here and it comes all the way down here. Can we predict that the muscle creates more range of motion, or does it create more force?
More force.
Not quite, Yuri. Range of motion. Now, Yuri, let's break this down. Why do you think this does not want to create force? So how about this? Let's go back to levers, guys. With this long muscle, long origin, long muscle belly, and long insertion, this is creating an overall longer lever arm. So remember the example, what we talked about with levers, the longer the lever arm, the less force and torque it's able to produce, and the more range of motion it is able to do. So because the muscle fibers are longer, it has a longer range to contract at, right? The muscle fibers have a longer way to go in order to contract. So therefore, it's going to create more range of motion. So the origin, the short head, now this is going to be important. The short head of our biceps is located on the coracoid process. So right now we have three different muscles on this one landmark. The long head of the bicep is located at the superior glenoid fossa. So I'm going to show you guys on. So here is our glenoid fossa. That biceps tendon, the long head originates up here. The short head is on the coracoid process. So long head is up here. And then the muscle belly, the two tendons come down. Again, we have two muscle bellies. And then it comes and joins together to create one insertion tendon, which is down on the radial tubercle or radial tuberosity. I call it the tuberosity. So the radial tuberosity. Who can tell me when our biceps muscle contracts, what actions are we going to see? What actions at the elbow? What actions at the shoulder? So remember, insertion gets pulled towards the origin. Okay, Jenna, Matt, good. Flexion, 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 a lot of flexion. Excellent, because that's exactly what it does. The biceps does elbow flexion. It also does shoulder flexion, elbow flexion, and shoulder flexion. The last movement is actually supination. So our biceps muscle not only does shoulder flexion and elbow flexion, but it also contributes a lot of power in forearm supination. And that's because of this one insertion point down here. When the muscle contracts, it's pulling the radius over. So when we pull our radius over like this, that creates forearm supination. Again, we're going to take a look at the biceps at the elbow, and the nerve for the biceps is also the musculocutaneous nerve. So we just saw that same nerve with our coracobrachialis. It is the same peripheral nerve for the biceps brachii. Okay. Oh, sorry. All right. So we're going to hit our first rotator cuff muscle. So I actually introduced them separately, and then we combine them and discuss them as a whole a little bit down the road. The reason that we are keeping them separate because this particular rotator cuff muscle is on the anterior side of the body, where the rest are considered to be posterior. So the first is the subscapularis, and this is the only rotator cuff muscle that performs internal rotation. Okay, so the origin for the subscapularis is the subscapular fossa. So here is an anterior scapula. The subscapular fossa is this right here. So the subscapularis comes over and it inserts on the lesser tubercle of the humerus. And again, this is the only rotator cuff muscle, and it solely does internal rotation. Sometimes you'll see medial rotation in your literature on an exam or anything. I don't care if you put medial rotation or internal rotation. It all means the same thing. And the nerve for our subscapularis is keeping it simple, subscapular nerve. Okay, here's actually a great picture kind of showing some of the, Did I skip over the brachialis? No, never mind. Ignore me. This is actually a great picture looking at the anatomy of these particular muscles that we just talked about. So our subscapularis, anterior scapula coming over and inserting on the lesser tubercle. Quick image of the coracobrachialis, coracoid process down to the medial humerus. And then that biceps muscle. Here's the short head and here's the long head. And they both come down to insert on the radial tuberosity. Brachialis we talk about at the elbow because it has no motion at the shoulder. It does not cross over the shoulder. And here are some images of the more superficial muscles. So these were deep. As you see, we had to take away all of these muscles in order to get there. So all of these are considered to be superficial. And we would have to retract the muscles. If you were ever to do a dissection, you would have to retract these muscles in order to get to these deep muscles. Okay, now we are moving on to the posterior group of muscles. So any muscle that is located on the posterior side of the body and comes to insert on the humerus, we can safely assume it's either going to perform extension, external rotation, horizontal abduction, or possibly abduction. So that's all because of that angle of pull and the line of pull. If something is pulling you, for example, if say a person was pulling your shirt from behind, you're going to fall backwards, right? You're not going to fall forwards. That's the same thing with a muscle. The muscle is pulling the bone from behind. So therefore, it's going to create motions that go posteriorly. So first muscle to add on to the group that we were talking about before is going to be our posterior deltoid muscle. So we're adding to that deltoid group. We already talked about the anterior delt. Now we're going to do the posterior. So the posterior deltoid originates, keep it simple, spine of the scapula. So the origin for our posterior delt is the spine of the scapula. Who remembers, without looking at the insertion, who remembers where do all of our deltoid muscles insert at? Where do all three deltoid muscles insert?
The deltoid tubercle.
Good, Courtney. Good, Mallory. Very good, Matt. The deltoid tubercle. The deltoid tubercle is, remember that thickened portion on the humerus about halfway down, and it's a bit more anterior and lateral right here. So I'm showing you a view of the humerus. This is an anterior right humerus, and the deltoid tubercle's about halfway down, and it's pretty lateral. So all of our deltoid muscles insert on the deltoid tubercle. So the posterior delt, if we look at this guy up here, the posterior delt originates on the spine of the scapula and then comes to insert on the deltoid tubercle. So this is going to cause horizontal abduction. So whether my arm is like this, it's going to pull this way. Or we bend our elbow, it's going to go that way. The fibers also will cause a little bit of extension, a little bit of external rotation, but the main function is going to be horizontal abduction. And we can picture that by pen. If this is the origin, this is the insertion. If we try and bring, if you picture trying to bring your mid-humerus back towards your spine of the scapula, that's the direction you're going to have to go. Horizontally abduct all the way. Does that make sense to everyone? How it performs this? So these muscle fibers, again, go backward like that. Horizontal abduction, a little bit of extension, and a little bit of external rotation. Anyone remember what nerve innervated, what peripheral nerve innervated our anterior deltoid muscle? What nerve innervated anterior deltoid muscle?
Auxiliary nerve.
Axillary nerve. Excellent, Yuri. Very good, Mercedes. The axillary nerve. Good job, guys. So keeping it simple, the axillary nerve also innervates our posterior delt muscle. Great job, guys. All right. Okay, our triceps. So our triceps, kind of a similar fashion to our bicep muscle in regards to our tricep is biarticulate. It crosses over the shoulder and it also crosses over our elbow. Therefore, the triceps muscle creates motion at the shoulder and also at the elbow. Tri meaning three, and seps meaning head, meaning there are three big muscle bellies that make up our triceps. So that means there are three different origins as well. So we have a long head. I'll try and make these different colors. We have the long head. We have the lateral and then the medial head as well. Here is the lateral. And then the medial, which is super tiny and more inferior. So long head, lateral, medial. The long head originates at the inferior portion of that superior, that glenoid fossa. If this makes it any easier for you guys to keep these straight, the long head of the biceps originates at the superior fossa. The long head of the triceps originates at the inferior fossa. Okay, so both long heads for the bicep and for the tricep originate in our glenoid fossa. The lateral, our lateral tendon originates on the humerus. So, okay, so the lateral tendon originates on our humerus, so the upper posterior humerus, and the medial head originates on the posterior distal humerus. So those are pretty simple and straightforward. The only tendon that originates somewhere on the scapula is the long head. Okay, so any type of shoulder motion that the tricep creates, it's from this one tendon. And then all three muscle bellies come together to create one tendon down here that inserts on our olecranon process. Who remembers? I tried covering it. What bone is the olecranon process located on? Okay, very good, Liz. The ulna. The ulna. So the olecranon process of the ulna is where our tricep inserts at. So when our tricep muscle contracts, it's going to create elbow extension and shoulder extension. Very simple and straightforward. So most of the force is being contributed to the elbow. So elbow extension and shoulder extension as well. Everyone see that? Make sense of it? So when the insertion down here gets pulled towards the origin, it's going to extend that elbow out. All right. Excellent, guys. We're going to keep on going. What do we got next? Continuing on with our rotator cuff muscles.
What was the nerve for the tricep?
Say that again, Yuri.
What was the nerve?
Oh, sorry, the radial nerve. I did not put that in there. You will put it in the chat for our triceps. It is innervated by the radial nerve. Thank you. Good catch. If it helps you to remember that nerve at all, the radial nerve, when from the brachial plexus, it comes out, pokes out the posterior side, and the triceps is that first muscle group it's going to hit. Okay, continuing on with our rotator cuff. Anyone remember the little acronym that we use to remember the rotator cuff muscles? What are they called? What do we refer to those, that this muscle group as? Very good, Mallory and Courtney. The sits muscles, S-I-T-S. So the next muscle we are going to cover is the eye, which is the infraspinatus. Infraspinatus of the rotator cuff. So when we are looking at our scapula, this is a posterior side. Here is our spine of the scapula. And this is the inferior portion. So our infraspinatus muscle originates from the infraspinous fossa, which is right here. It's then going to come over and insert onto the greater tubercle of the humerus. Okay. Out of our rotator cuff muscles, the subscapularis is the only rotator cuff muscle that inserts onto the lesser tubercle. The other three all insert on to the greater tubercle. So that also should help kind of keep things kind of straight. Let me put that in here. So subscapularis, internal rotation, and then infraspinatus, supraspinatus, and our teres minor. They all do external rotation and they all insert on the greater tubercle. Okay, so the infraspinatus, when it contracts, the greater tubercle of the humerus is going, so the humeral head is going to externally rotate. So this is one of our external rotators of the humerus. So it performs this, also that. Humeral head is rotating externally. And for our infraspinatus and I believe the rest of the rotator cuff muscles, I think they are all innervated by the same nerve in that area. Yeah, these are all the suprascapular nerves. So all of our external rotators that are located on the posterior scapula are all innervated by suprascapular. Okay, moving on to our teres minor. So here is our third rotator cuff muscle. As you can see, this muscle of the rotator cuff sits directly lateral and below where infraspinatus was located. So on that posterior scapula, infraspinatus was all in this area. And teres minor sits right next to it. So this is obviously the T of our sits muscle group. And teres minor, so it originates on the lateral border of the scapula. And it comes up to insert on that greater tubercle, as we mentioned earlier. So teres minor, again, does external rotation of the humerus. So in the rotator cuff group, 3 of those muscles do external rotation, 1 does internal rotation. So this is another external rotator, and the nerve that innervates our teres minor is our axillary nerve. Okay, we are almost there, guys. Great job. Keep it up. Just keep staying organized and please ask questions if you're confused on anything, any of the movements, locations, or not understanding how a muscle located here could cause abduction. I don't know, just an example. But please ask questions if you are confused by any of this. Okay, now we're looking at superior muscle group. So the superior muscle groups are muscles that sit on the superior part of our structures. So for here, it's going to be our scapula. So now we are looking at our final deltoid muscle, the middle deltoid. So the middle deltoid muscle fibers, they run pretty straight down. Okay, so they start up here and they originate on our acromion process. So if you look over here, the acromion process. That was a terrible drawing. FYI, where the red is located, that's indicating where that muscle is. Sorry. So here's that acromion process. It's mainly on the acromion, and then it comes down again to insert on that deltoid tubercle. So when these muscle fibers that run almost directly straight down, we have a few fibers that kind of come from the posterior side for the middle delt, and some that come a little anterior as well. But predominantly our middle deltoid is going to do shoulder abduction. It's going to pull that arm straight up. So insertion to origin is pulling our arm almost straight up. Okay, that's the action I want you guys to focus on for our middle deltoid. Shoulder abduction. And for just like our posterior and anterior deltoid, this muscle is also innervated by the axillary nerve. So all of our deltoids are innervated by the axillary nerve. Again, I'm going to kind of emphasize why it's important that I want you guys to know these nerves. If you start having muscle weakness, unknown reason for muscle weakness, the muscle starts atrophying and you're really not sure why. Perhaps it's yourself, on a patient. It's usually neurovascular damage. It could be a pinched nerve. It could be a nerve. It could be the nerve that's innervating that muscle where it comes off of the spinal cord. So again, it is really good knowledge for you guys to know these. I know it seems more tedious, but you got to learn some point, and why not learn it here? Okay. All right. The next superior muscle is going to be our final rotator cuff, which is the supraspinatus muscle. So the supraspinatus, pretty kind of neat muscle because of how straight across this muscle goes. It originates in our supraspinous fossa. So this whole area is the origin, the supraspinous fossa. And again, it's going to insert on that greater tubercle. Okay. So when our supraspinatus fires, it's going to perform external rotation. It's also going to perform shoulder abduction. Now, it's a rotator cuff muscle. Why is it performing abduction? That's all because of the direction of these muscle fibers. So they, again, start here and here. The muscle fibers go straight across. So when it fires, the muscle contracts. Remember, insertion is going to get pulled towards the origin. So this, because it's straight across, it's going to follow that fiber direction, and it's going to pull that humerus up just like that. Okay. And again, it still does a little bit of external rotation as well. But it's important to remember the supraspinatus is the only rotator cuff that equally performs another action, which is abduction. So external rotation and abduction. And as I mentioned earlier, it's already in the chat. The supraspinatus is also innervated by the suprascapular nerve. Okay, latissimus dorsi. I don't know why this muscle is so fascinating to me because of how large it is. Like, look at this bad boy. It's massive. The lats are huge. I will say males generally have larger lat muscles than females do. And this muscle is a huge reason as to why males as to why people can properly perform pull-ups along with even push-ups. So of course, tries have a lot to do with it, but the lats have so much to do with it. So our latissimus dorsi, as you can see, once again, it starts out super, super wide. And it actually, the origin, it starts out with a ton of additional aponeurosis tissue. So remember, aponeurosis is that thin sheet of fascia. And that aponeurosis is what connects the bone to the muscle. So the origin for our lats is going to be the spinous processes from our thoracic vertebrae. So it's about 1, 3, 4, 5, 6, 7, T7, going down to probably L5. Looks like L5. And then it even has some origin on the sacrum. Okay, so that's very large. There we go. So very, very large origin. And then it turns into a funnel where it narrows itself down into this little tendon that inserts on the medial humerus. So where that bicipital groove is, our lat muscle also inserts by that bicipital groove. So as you guys know, here's a picture. Here is our bicipital groove right here. So this is an anterior humerus. Here is our bicipital groove. So the lat muscle comes in on the medial side of the humerus to insert on the medial side of the bicipital groove. So when that lat muscle contracts, it's going to perform shoulder extension. So it's going to pull the humerus back. It's going to perform internal rotation. So it's going to also pull the humerus internally. It's also going to perform adduction. So it's going to slightly pull the humerus back towards the midline. Okay. So shoulder extension, adduction, and internal rotation. What this big bad muscle does. We talked about the pec major muscle earlier, and the pec major again starts out super wide and it turns into a small insertion area. So similarly to pec major, our lat muscle also is able to produce a lot of force. And the nerve for our lats is called the thoracodorsal nerve. Probably one of the cooler names for the nerves, thoracodorsal. All right. Okay, last muscle we need to cover is teres major. So we have a teres minor, which is part of the rotator cuff, and it sits right here. Teres major is a lot bigger than teres minor. And teres major is not part of our rotator cuff. Okay, teres minor is part of the rotator cuff. It is one of our sits muscles. Teres major is not. The nickname for our teres major is called the lat's little helper. Okay, it's kind of cute. It's the lat's little helper. So teres major helps out our latissimus dorsi muscle. The reason it is called the lat's little helper is because they perform the exact same motions. Okay. And you can even see from here the angle at which our teres major originates from. So it originates on the lateral inferior scapula and it comes up to insert right exactly where the lat inserts at, the medial groove, bicipital groove. So it comes up to insert once again on the medial groove here. Okay. So when this muscle fires, it performs the same exact motions as our lat. It does shoulder extension, internal rotation, and adduction. Even go back and forth. Look at the direction of these muscle fibers compared to the direction of the fibers of the lats. They're the same. Hence why they are able to produce the same motions. They have the same angle of pull, and they happen to be inserting on the same location. So obviously the lats is much smaller, so it does not recruit as many muscle fibers or neurons. So it is the force production is not as strong as our lat, but it does the same motions. And the nerve for our for the teres major is the lower subscapular nerve. Does everyone see how teres major and the latissimus dorsi are so similar? They might not be located in the same area. Cassiana, the origin is the lower inferior clavicle. Lower inferior clavicle. I'm sorry, I said clavicle, scapula. Sorry. Tuesday. My fault. So lower inferior scapula. Okay, so we are not going to get through the rest of these slides. I am leaving it up to you on your own. The rest of the slides do not talk about any new muscles. I actually am going to take this slide out. I think it's stupid. We already went through these. But the last thing you guys are going to have to look at on your own, because we need to start the elbow on Thursday, is shoulder ligaments. It goes through the few shoulder ligaments, and a ligament connects bone to bone. So all of these ligaments, I want you guys on your own to break down these ligaments, find where they are, and tell yourself coracohumeral. So the coracohumeral ligament goes from the coracoid process to the humerus. Coracoacromial, coracoid process to the acromion. Coracoclavicular, there's two right here. Makes sense? So that is the shoulder ligaments. The transverse ligament is the only kind of different one, where the transverse ligament goes over that biceps tendon. So here in the bicipital groove, we have the biceps tendon. The transverse ligament holds down that bicep tendon. Okay. So again, on Thursday, you are going to have a quiz. It is on shoulder muscles, pectoral girdle and glenohumeral girdle muscles, shoulder joint and pectoral girdle muscles. Got to get it together. All right, guys, if you have any questions, feel free to stick around. If not, I will see y'all on Thursday.
Professor Erndell,
Yes.
do we take that quiz during class or is it just due by the end of the day?
It'll be due at the end of the day. I really hate wasting time by having you guys take a quiz during class. Jared, there might be ligaments on the quiz. Right now I don't, but it might not hurt. I think you guys really need to look over those. There's not a lot. It's very straightforward, but good question. Nerves also might be on it. The nerves that we have covered. So make sure you guys have been taking good notes for the nerves. Have a good day, guys.
Thank you.
Have a good one.
Thank you. Have a good day.
You too, guys. See you later.